Hello, everyone, and welcome to today's webinar on the 2017 SOAR outcomes. Today's webinar is presented by the SAMHSA SOAR Technical Assistance Center at Policy Research Associates. My name is Kristen Lupfer, Project Director of the SAMHSA SOAR TA Center, and I'll be moderating today's event. Is supported by the Substance Abuse and Mental Health Services Administration, or SAMHSA, and the U.S. Department of Health and Human Services. The contents of this presentation do not necessarily reflect the views or policies of SAMHSA or DHHS. Housekeeping items before we begin. Your lines will be muted throughout the webinar. The webinar is being recorded and will be available for download on the SOAR website in about a week. Right now, you can download the PowerPoint slides to view following the webinar. So if you look to the top of your screen, you can go to File, Save Document to download the materials. You can also access the file by following the link to the SOAR website at the bottom of this slide. And this afternoon with a welcome from Robert Grace, Health Analyst with the Homeless Programs Branch at the Center for Mental Health Services at SAMHSA. I'll provide a brief overview of the National 2017 SOAR outcomes and introduce our SOAR superstar states. You'll then hear about the incredible improvements that New York made last year from Linda Camoin, SOAR State Team Lead and Assistant Director at the Bureau of Housing and Support Services at the Office of Temporary and Disability Assistance in Albany, New York. You'll hear about consistent progress in Arkansas from Abigail Kirkman, the SOAR TA Center Liaison to Arkansas, on behalf of Mathis Conway and the team at Mid-South Health Systems. And then finally, our Tales from the Top 10. Ashley Moore, SOAR social worker at Bread for the City in Washington, D.C., will share with you what they've been doing to bring their SOAR program into the top 10 this year. And with plenty of time for questions and answers. I'm pleased to introduce Robert Grace. Mr. Grace is the Federal Project Officer for SOAR and share a few words of welcome. Robert,
Kristen, a warm welcome to all of you for joining us today. On behalf of the Substance Abuse and Mental Health Services Administration, SAMHSA, and the Center for Mental Health Services Host Programs Branch, I want to welcome you to SAMHSA SOAR webinar celebrating the 2017 SOAR outcomes. SOAR helps states and communities increase access to Social Security disability benefits for eligible adults who are experiencing or at risk of homelessness and a serious mental illness, mental impairment, and or occurring substance use disorder. Over the last 12 years, the SOAR approach has been used to assist over 3,861 people with their SSI/SSDI applications. Today's webinar, we'll learn about the successes of the year. I'd like to welcome and thank our presenters for today. Linda Camoin, Director of the Bureau of Housing and Support Services at the New York State Office of Temporary and Disability Assistance, and Ashley Moore, SOAR social worker at Bread for the City, Washington, D.C. Thank you for your willingness to share your successes and expertise with us. I'll turn you back over to Kristen Lupfer, moderating today's webinar. Kristen?
thanks, Robert. Many seasoned SOAR advocates on the webinar with us today, and I hope that we have some new people who are interested to learn about the impact that SOAR make. So I'm going to share a few brief words of introduction about SOAR before we get into the outcomes. I probably mentioned SOAR stands for SSI, SSDI, Outreach, Access, and Recovery. And it's not just about the applications, it's about what role the benefits can play in transforming lives. SOAR is a SAMHSA-sponsored program that's focused on increasing access to Social Security disability benefits for individuals who are experiencing or at risk of homelessness and have a serious mental illness, medical condition, or co-occurring substance use disorder. SOAR is active in all 50 states, but each state is at a different level of implementation. There's federal funding for SOAR activity, and so the SOAR TA Center works with states and communities to develop plans for implementing the program through technical assistance and training. We talk a lot about the income and health insurance that's gained with approval for SSI and SSDI benefits. While absolutely essential, they're only one brick in the foundation for stable housing, recovery, and wellness. SOAR seeks to end homelessness through increased access to SSI and SSDI income supports. And this is essential because many persons in recovery accessing benefits is that first step. But SOAR extends beyond and also encourages employment as a means to increase individual income and for promote recovery. Once a person's been approved for disability benefits and is stably housed, we see a decrease in hospitalizations and incarcerations and a stronger foundation for wellness and recovery. I want to begin by thanking all of you for the incredible work that you do. These outcomes represent the hard work that you put in and day out. We're really excited to be able to celebrate these successes with you. We don't ask you to formally report these outcomes once a year, but I do hope that you'll continue to share your stories throughout the year. We absolutely love to share individual success stories in the e-news and on the SOAR Voices blog. We have an incredible story from Nebraska that we're sharing in an e-news edition that's releasing next week. It is not to be missed. Check your inboxes. And demonstrating the impact that you make in people's lives through these outcomes is not key to supporting and expanding your programs, but sharing these stories is so important in sustaining ourselves in this hard work. It's hearing the individual stories of transformation that really validates why we all put in the long hours. So without further ado, here are the numbers. From July 1st, 2016 to June 30, 2017, SOAR providers helped 3,563 people experiencing or at risk of homelessness get approved for SSI or SSDI on their initial application. There were an additional 636 approvals on appeal. Decisions on SOAR-assisted initial applications were received in an average of only 96 days in 2017, which is a decrease of 5 days from 2016. The average days to decision on appeal was 186 days, which is over 3 times faster than the average hearing office processing time of 605 days. Cumulatively, SOAR providers have served over 63,000 individuals. 65% of those initial applications were approved. So when you combine the 34,919 initial application approvals with the 5,392 approvals on appeal, there are 40,311 people who have gained access to Social Security benefits with the help of SOAR. It's an incredible impact. 40,000 people. Thank you. So those are national numbers, and they're so fantastic. But let's look at our top 10. Our top 10 criteria require that states had at least 200 cumulative decisions, had approval rates that were at or above the national average in 2017, and of those top 10 states, the average approval rate for these rock stars is 84%. So in order of average cumulative approval rate, the top 10 states are Pennsylvania, 92%, Tennessee with 90%, Maryland with 86%, Arkansas with 83%, North Carolina with 79%, Rhode Island with 77%, Washington with 76%, Oklahoma with 73%, Wyoming with, in the District of Columbia with 72%. The top 10 states have this average approval rate of 84% for 10,416 applications. So they're not only submitting successful applications, they're able to do so over and over again. And we're going to hear more later about how to do it. So compare. Based on the most recent data available from SSA, the national approval rate for all SSI applications at the initial level is 20.5%. So most people are denied. The national average for all SOAR approvals, like we just heard, has more than doubled that and is 64% this year. You just heard our top 10 states are currently averaging at 84%. So we're going to be hearing on this call about what you can do to help rise to the top of the pack. And so will your state be in the 10 next year? Not only have you more than doubled approval rates over the national average, you're also efficient and effective. SOAR applications are approved in an average of 96 days compared to the national average processing time of 111. And it's important to note that by getting applications approved at the initial level, we're avoiding appeals, which, like we said, currently take on average 605 days. So giving processing time and money. We also give a shout out to states that have the most improved capacity. So Massachusetts, Utah, Nevada, Kentucky, and Idaho showed great improvement in their total decisions and approvals in 2017 from what they reported in 2016. So collectively, these 5 states went from a total of 85 approvals in a year to 256 approval following year, which is a 201% increase. You just heard that the national average days to decision went down 5 days, but there are 3 states that showed even greater reductions in their average days to decision. New York, Montana, and South Dakota went from an average of 164 days to decision in 2016 to only 89 days in 2017. So collectively, that's a reduction of 75 days on average. We know how important quality review is and work hard to get as many eligible applicants approved as quickly as possible. And these states made a particular effort and strides last year to improve their approval rates. New York, Illinois, Wisconsin, and South Dakota showed the most improvement in their approval rates in 2017 from what they reported in 2016. New York's approval rate increased by 105%, and Linda's going to tell you more about that in a couple minutes. Illinois had a 51% increase, and Wisconsin and South Dakota had increases over 30%. So you can make great and turnarounds in only a year's time. So we're making impact on individual lives, but we're also making an impact on state and local economies. In just 2017 alone, SOAR-related SSI and SSDI brought $356 million into the economies of the participating states and localities. 8 states reported Medicaid reimbursements totaling $503,000. That's an average of almost $6,000 reimbursed per approved application. State-reported public or general assistance reimbursement by SSA showed an average of $3,562 per approved application. We also received reports on retroactive benefits for over 1,600 approvals, and they averaged $5,520 per person. That really goes a long way in helping transitions to housing and long-term stability. Reimbursements and increased income is really making quite a significant impact, especially on sustainability efforts in these communities. Also thrilled to see continued interest in collaborations with corrections and work with justice-involved persons. We're seeing more and more in-reach to local jails and then coordination with parole and probation to coordinate services. We see SOAR being incorporated into jail diversion programs and pre-release planning in state prisons. Departments of Correction are training staff on the SOAR process to help ensure that pre-release preparations include access to income and health insurance for those who are eligible. These collaborations have been great, but they aren't always easy. So we're looking at different systems that operate in unique and complicated ways, and change can be difficult. But our mantra remains decision before discharge, and hard work and careful planning can really make that happen. We were excited to award 6 more criminal justice agencies a SOAR Technical Assistance Award last month. So if you missed that in the SOAR e-news letter, check that out for more information. Adults who are age 18 to 24 can face particular challenges when applying for SSA disability benefits. However, many SOAR providers are seeing a lot of success in serving this special population. So states that were working with transition-age youth assisted 332 youth with their applications at a 63% approval rate in an average of 96 days. They were also really successful with reconsiderations, and they assisted 3 additional youth with an approval rate of 62% in 103 days. So the outcomes really help to dispel myths around this age group. Employment is especially beneficial to people with disabilities as the benefits go far beyond the monetary gains. People who are seeking or receiving SSA benefits are encouraged to work or seek employment either independently or with the help of professional supports such as the Individual Placement and Support, or IPS, supported employment programs. While reporting on this is still gaining momentum, and despite the myths about working while applying, 29 states reported that 128 applicants were working during the application process, and they reported earnings of $82,000 for those applicants. So proof that it's possible. CABI, or Cooperative Agreements to Benefit Homeless Individuals, and SOAR are 2 important programs administered by SAMHSA that really work together to end homelessness. And last year, the SOAR TA Center facilitated a learning community and year-long pilot with 12 states that aimed to successfully integrate individual placement and support, IPS, and SOAR services with the CABI States Enhancement Grant Program to maximize income and housing stability. The integration pilot really demonstrated success in increasing dual enrollments in both SOAR and IPS services, strengthened collaborations between the programs, and resulted in increased income stability for program participants. In 2017, 24 states reported that they were successful in securing new funding for their SOAR programs, resulting in the creation or continuation of a total of 411 full-time SOAR benefits specialist positions and 178 part-time positions. These are incredible numbers. Just years ago, we were reporting 60 positions nationwide. That is an 882% increase. Incredible. Examples of the funders include SAMHSA's PATH and CABI grants, block grants, CDBG and HBG, foundations, Medicaid, local and state funders, and we're looking to expand and increase these numbers all the time. We have a lot of wonderful collaborations built from SOAR programs, and one of the greatest collaborations through the years has been with PATH. SAMHSA funds the PATH program, Projects for Assistance in Transition from Homelessness. Funding is available to all 50 states and the territories, and almost all states have trained PATH providers on the SOAR model, but some states have really gone above and beyond and dedicated benefit specialists on PATH teams and required SOAR applications as part of contracts with PATH providers. The last point is really making a big difference in number of applications being assisted in those states, as well as the kind of outcomes so caseworkers really get credit for their work. 1/3 of the State Path Contact Service SOAR coordinators, and the others are very supportive of SOAR efforts. So we are so proud of the collective SOAR efforts and really wanted to celebrate some specific programs. I'm now honored to turn it over to our superstar, who will tell you more about how they've been able to make it happen. First, from Linda Camoin, Assistant Director of the Bureau of Housing and Support Services at the New York State Office of Temporary and Disability Assistance, and the SOAR State Team Lead for New York. Linda?
Glad to be among some superstars, and hopefully we can continue to build on the successes we've seen. As you mentioned, my name is Linda Camoin. I'm the Assistant Director in the Bureau of Housing and Support Services here at the New York State Office of Temporary and Disability Assistance. I oversee all of our services programs for people who are homeless and at risk of homelessness. I'm happy to be the state team lead for the last year or so, year and a half, and I'm continually learning about SOAR and all that it can do and ways that we can expand it here in New York. So to give you a little bit of an overview of how we have been trying to expand SOAR in New York State, this first slide shows a map of the state, and it's basically broken out by continuum of care. And so darker areas, darker shaded areas that you see on the state are those areas with higher PIT counts. So the point in time counts that are done every year, that's where we are higher numbers of people who are homeless. And it's generally our more urban areas, obviously New York City, Long Island, and then we have Buffalo, Syracuse, and Rochester kind of in the middle of the state. And then on top of that, we have the blue circles that represent the SOAR course completions. And so you can see SOAR is being done across the state, and it also is, to me, shows us where we need to try and concentrate our efforts to increase SOAR in different areas of the state. So, just to point out that there are obviously the darker areas, as I said, are the urban areas, but there's a lot of rural parts to New York State, and so we have been using this continuum of care structure to try and further our efforts across the state. As I mentioned, I've had some great successes over the last year. The approval rate, we've seen an upward push over the last several years, and hopefully we'll make it into the list of the top states over the next couple of years. We believe the more positive outcomes speak to increased case management involvement across the state. Specifically in Buffalo, since September of 2016, they've made a concerted effort to get greater involvement of SSA and DDS. And they have also done a really good job of coalition building out there. Another area in New York where we've seen success and some of these increased rates can be attributed to is in New York City, with a justice-involved project at Sing Sing that has seen some great success, as well as with a program called Streetworks, which works with transition-aged youth in New York City. So we're excited about those two programs. Just a couple of key points about SOAR in New York. Again, we've focused the growth through the continuum of care system, and we have, given the large and geographically diverse nature of New York State, we felt like that giving the employee a continuum care or wide up approach rather than a top-down approach would work better in New York State. And as OTDA, as our agency goes out and we engage with our continuums of care and engage with our service providers at different regional meetings, we make sure to speak about SOAR and its importance and how it's a great tool to assist those who are homeless at risk of homelessness. We also held this past September a SOAR Leadership Academy here in Albany for leads across New York State. So it was modeled after the leadership academies that the SOAR TA Center holds nationwide. So we were happy to sponsor that here in Albany. Excited to have here in New York one of the criminally justice involved TA awards on Long Island, and excited to get that going over the next few months. And there's also been some great tailored TA been awarded to communities in New York State that's helped increase the effort across the state. In addition, OTDA has really tried to be supportive of all the online course cohorts across the state and have that consistent engagement from OTDA in the state in connection with the SOAR TA Center. And Abby Kirkman has been a great partner here in more that the initiative across the state. So that's it for New York. I don't know. I think Abby is next, and if she had anything she wanted to add about New York, I'm open to that.
Thanks so much, Linda. We truly appreciate you making the time this afternoon. So I'll introduce Abigail Kirkman, who's the SOAR TA Center liaison to Arkansas as well, and she'll be presenting on behalf of Christy Mathis-Conway and the team at Mid-South Health Systems. Abby?
All right. Thank you so much, Kristen. And it is indeed my honor to be presenting on behalf of Christy and the team at Mid-South. They have done some really great work over the past kind of half decade with SOAR, and I'm really excited to tell you guys a little bit more about what they do. But before I do, I want to tell you the reason that they're not able to be here to present for themselves today. And I think it's a really awesome reason, and they've been able to work SOAR into this. So in addition to being the SOAR local lead for the Jonesboro or Northeast Arkansas area, Christy is also the collaborative specialist for all of the specialty courts within Craighead County, which is where Jonesboro is located. Within these specialty court systems, they have a mental health court, a veterans diversion court, sobriety court, adult drug treatment court, and juvenile treatment court. And their mental health court has been labeled a model mental health court for the state of Arkansas, which means that if anyone or any community from Arkansas or Tennessee is interested in starting a mental health court, they are welcome to come and visit the mental health court in Jonesboro. And today is one of those visitation days, and they're also having a graduation celebration for those who have graduated from the court. So that's why they're not able to be here today. But in addition to this mental health court, they've really been able to incorporate SOAR into it, which is just really neat. So oftentimes when individuals come into the court system and they have been identified as someone who may be struggling with a mental health issue, they will be referred to the mental health court. However, in order to be a part of the mental health court in Craighead County, they must have a stable residence within Craighead County. And most of these individuals are homeless or at risk of homelessness and do not have that stability. So they will be referred to Christy and the team at Mid-South who will do an intake for both housing and SOAR. So when decided that they're able to work with this individual, Mid-South will alert the court that they are working with them on not only housing, but also on getting benefits, and the court will give them a temporary pardon. And this will also allow them to be able to take on emergency assistance, which will help them in securing housing for the short term until they are able to go on and get their benefits through the SOAR process. And so you can see that the likelihood that these individuals getting their benefits is really high. So let's talk a little bit about Arkansas by the numbers. Arkansas has been a consistent top 10 member since 2014. And part of the reason that they have been able to be so consistent and a member of the top 10 states is due in large part to the activity that is happening in Mid-South. You can see that all the way back in 2012, they had a 90% approval rate. They fell down to 80, which is still amazing in 2013, and then they've just been consistently rising back up to 94%. 2017. And throughout these 6 years of data, they have always averaged a really great turnaround time. So between 90 to 120 days for their average decision time. Now, I think it's a really great example of not only being able to serve one community effectively, and that would be their kind of hometown or home base of Jonesboro, but Mid-South is by definition a healthcare system. Their main clinic or their main mental health clinic is located in Jonesboro. However, they also serve 13 counties across the northeast section of Arkansas. And as you can see from the map, these are rather large and rural counties. So it's not as if they're just serving one kind of diverse urban population, but they're really looking to expand and have successfully expanded SOAR throughout the northeast area of Arkansas. Let's talk a little bit about how they have been able to do this and how they have come to be so successful. Mid-South was actually one of the first organizations to ever have someone trained at a SOAR Train the Trainer back in 2008. Shadun Duncan attended that training, and he came back to Mid-South with the goal of selling SOAR and getting the Community Mental Health Center involved in SOAR. And really, he started at the bottom. He started meeting with a series of case managers. He met with the program managers and really proceeded to sell SOAR. But he couldn't stop there. He also met with the local SSA office as well as the local DDS office, where they were setting up protocols, and they were also meeting with doctors at DDS to get buy-in for the process. And what's really interesting is a lot of the people they met with back in 2008 are still there today, and they've kind of moved up the ranks and have advanced along with the SOAR initiative, and they're still able to call them up, and they really have bought into SOAR over the period of almost a decade. One of the things that they were also able to do is designate specific examiners, so that anything that's flagged as a SOAR case will go to a specific examiner. And they have a great relationship with this examiner. His name is Dr. Brad. He is super responsive and really sees the benefit of SOAR. And as Christy said, having this connection with the specific DDS examiner, she said, made our clients become more than just a number to us. We were able to call them up and talk about their cases. So then from 2008 to 2013, we really see this as a period of stability for Mid-South. This is also when Christy Mathis Conway came on. She attended a SOAR Train the Trainer back in 2013, and then just recently, or back in 2016, she attended the SOAR Leadership Academy as well. So she is both a trainer and local there. And when she came on, what they really focused on doing is expanding SOAR outside of the Jonesboro Mid-South area. Since they have 13 counties, there are 13 clinics, so one in each of those counties. The main one's obviously in Jonesboro, and that's the largest, but they have smaller or medium-sized clinics throughout the other 13 counties. And they found that they need to have at least 2 SOAR-trained case managers at every single one of those clinics. So what will happen is Christy will go around to the individual clinics, and her and Shadun will do trainings for the staff. Some will receive kind of more of an introduction about SOAR, but they will ensure that there are 2 trained staff who are able to take on the referrals. So whether or not you're in Craig County or in Mississippi County or Lee County, if you come into a Mid-South clinic and are in need of SOAR services, you will be able to access someone in your immediate area. And more recently, since 2013, one of the things that they've really focused on and what they felt they needed to do was broaden SOAR throughout their company. So what they did is they incorporated SOAR and a SOAR orientation into their new employee orientation. So everyone from the CEO to the person who drives the vans to a case manager is going to become familiar with the SOAR process. And what Christy said is that it made people really excited. They got really excited about the process, not only at the prospect of helping the community, but oftentimes they would know people who could benefit from the process, and they would refer in. And what Christy also said is that having everyone at the agency know about SOAR and have that buy-in for it, it made them more aware of the process, but it also ensured that they were going to get very good referrals for the process. So what works for Mid-South, and how have they been able to be so successful? thing is good referrals and a strong referral process. And this goes back to every employee at Mid-South Health System being aware of SOAR. The other thing is that they have in-house medical staff and really strong collaborations with outside providers, and overall they provide wraparound services. When an applicant or potential applicant comes into Mid-South, they will receive an intake, and automatically that person is seen by an in-house therapist who will do a psychosocial report. They'll assess for mental health, substance use, and also physical health. And after that's done, then a second round of evaluations will occur to determine whether or not the applicant is a good SOAR applicant. So once they identified that they are going to be a SOAR applicant, SOAR case managers will begin working with that applicant. But at the same time, they've also been assessed for these wraparound services that are provided by Mid-South. So one example of this could be a rehab day program. So with this, working with the case manager to do the SOAR application, but at the same time, that SOAR case manager will be able to contact those wraparound service providers to get feedback and updates on the applicant so that they're always able to provide the most comprehensive information to SSA and DDS. They have also had consistently positive relationships with Social Security and DDS. Like I mentioned before, a lot of the individuals who they started with at SSA and DDS are still there, which is really positive, but some people have changed. So they've really done a great job of consistently engaging with SSA and DDS and gaining their buy-in for the process. And overall, they've really focused on having a streamlined SOAR process within the Mid-South Health System. For an agency that serves 13 counties, you can't operate a successful program over that much area without having something streamlined. So one of the things that Christy says is when someone begins a SOAR application, since she is the SOAR local lead, they alert her, and she is the one who's able to follow up and ensure that everything's going as it should with the SOAR process. She's able to process that quality review and really be the point person for any questions that those SOAR case managers have throughout the process. Now, it's not all wonderful. It doesn't all work all the time, and that's when they do have some challenges, but they really consistently work to get some positive resolutions. So some of the challenges that they have is that there is very limited housing availability in Craighead County, which is where Jonesboro is located. But additionally, and even in the more rural areas, there really is a lot of challenges with getting stable and affordable housing. So what they've done is they worked very closely with the PATH team, which Kristen mentioned in her presentation. And what they see is really a two-way referral system. So PATH may refer to the SOAR program so that they can get applications and get that income. And then additionally, they might refer if someone is in need of PATH housing. Mid-South has also done a great job with creating some housing within their own organization, and they've also worked to build relationships with landlords. They also see a large transient population. They work with a very large and rural area, and sometimes people will come and go, or they'll start an application and they won't see them again. But one of the things that they really have done a great job of is a lot of collaborations and coordinations with services that aren't necessarily within Mid-South. So Christy will tell me that the local jails know Mid-South, and if one of their applicants is to turn up there, they will call and say, hey, are you happen to be working with this person? And just to let you know, this is where they are. Additionally, they have outreach to local attorneys and legal aids in the area, that if their applicant pops up, they'll be in communication with them. So Arkansas in general, but specifically the northeast portion and with Mid-South, it's such a collaborative environment, which has really allowed SOAR to be consistently strong. And then lastly, they say it's always a challenge working with rural communities, but I think Mid-South has done a great job of positioning clinics within each of the 13 counties. So if you're located way down in the Lee area, you know that you don't have to travel an hour or two up to Jonesboro, that you can get services in your community, which means that they're much more likely to engage consistently. So overall, Mid-South and Arkansas have been rock stars when it comes to SOAR, and we really look forward to the amazing work that they'll continue to do moving forward.
So much, Abby. So last but not least, our from the top 10. I'll now turn it over to Ashley Moore, SOAR social worker at Bread for the City in Washington, D.C.
Thank you. So yes, I'm Ashley. I am the SOAR program manager here at my agency called Bread for the City. I've been doing that since 2011. I created and managed the program, and we have maintained 79% success in initial applications, and in that time we've done about 160 applications. And we're particularly proud because that represents about half of DC's SOAR applications. Also here as the DC state team lead. Just as a quick sidebar, not everyone knows this, but DC is not a state, and some of the implications for the roughly 693,000 people who live here, and that population is greater than 2 states. Big one is that we have no voting members of Congress, and that's why our license plates say taxation without representation. So I just like to remind people that while the federal government is here, people also live here, and I am one of those people, and I find DC to be an exciting place to live and to do SOAR, and I know on behalf of our team, we feel so proud to be on this today and grateful for the never-ending support of the TA Center and specifically Jen, who is our liaison. So I want to go over DC's numbers. We had this last year 73% approval rating on initial applications, 67% on appeals, on reconsiderations, and also had a huge increase in the total number of applications. This year we had a 79% increase. So I'm going to talk about how we got here, each of these 4 things. First, our leadership team. 2 years ago, the leadership moved DC government to nonprofits with successful SOAR programs. DC government was not the best place at the time for the SOAR leadership to be because there wasn't a whole lot of actual SOAR happening within the DC government. The successful SOAR programs were happening at nonprofits. So that move helped SOAR move along because those who were actually doing cases had already built the relationships that we needed to be successful and have the knowledge of how cases might actually work. And so we really were able to take off 2 years when that switch happened. Our leadership team has representatives from each agency with strong SOAR programs, so a lot of the people who attend are very invested in the success of SOAR. We also have legal representation. One of the lawyers there, I put street lawyer because his name is Scott, and he was one of the inspirations for John Grisham's novel called The Street Lawyer. He came and did his research and met with Scott and his team. And Scott's been around for a very long time and has both knowledge of the of security from a legal perspective and also kind of the history of DC government programs, which has been really helpful. We have advocacy representation. A few various agencies or city have got involved in advocacy just this last year with us. So they're partnering with us to see and helping us figure out how we can advocate for more SOAR funding and SOAR being written into contracts and things like that. So it's been really great to have people on our team. We also have a professor from Catholic who's been great and a big SOAR supporter for us. And she led a strategic planning session for our team. She puts training space, and then this year we're kicking off a pilot of having SOAR students placed at a few agencies to help expand capacity. We have regular meetings with active participation. We also have amazing SOAR providers, which is why we're also here. Many of the active SOAR providers are also SOAR leaders, and we have meetings every other month. We rotate between a SOAR provider meeting and a SOAR leaders meeting. Another thing that happened in the last couple of years is we have developed a really great partnership with Social Security and DDS. He recently left our local offices, but our former district manager was very supportive of our community partners in general, and SOAR specifically helped us put an actual SOAR process in place. That the Social Security offices were nice to us, but would not really make any accommodations or open to doing anything different, and he really saw the value of having a SOAR process and specifically a SOAR contact at each of our offices, so we're able to submit cases electronically, and we have someone we can email or call. So that's been extremely helpful. We have always had good relationships with the staff at our local DDS office, and just recently, with the last few months, we've been able to have dedicated SOAR examiners at DDS and one specific supervisor who supervises those examiners. And again, this change happened because there was someone who had always been nice to us but didn't really see make any changes. For example, this team of examiners that we'd hoped for, but when she left, we had kind of greater access to the director and who quickly made the changes. So we've realized the importance of the nice people are great, but having it can actually get that to move into a system, then that will live past the current staffing, and that's what we found to be the most helpful. So even if the director leaves, yes, at least have this dedicated examiners already in place, so we'll continue. The reason for the great increase in applications is really because of new dedicated SOAR funding, specifically CABI. There are 4 CABI teams now in DC, and that really helped increase our outcomes. And they specifically, a couple teams who hire dedicated SOAR workers, they've been supervisors and doing really great work. JES also paid for coordinated entry for 2 agencies, and that's really helped as well. And we also have some SOAR funding going to TANF Power program. And so all this has led to increase the number of applications. Last year or so, we've also really tried to do a much better job of quality review and support for our SOAR providers. So we moved, in the past, the leadership had been resistant to kind of a SOAR certification, but we decided that would be the most helpful process to make sure that qualifications are happening. So we ask all new SOAR providers to do the online course, and then as soon as they graduate from that, we do an in-person to go over the DC specifics of the process. We've all now started to do 2 cohorts every year to encourage more people who have expressed interest to actually complete that, and we do phone calls and check-ins to help that happen. We also have been doing, this year we did a couple cohorts for specific agencies who we knew wanted to do it. So we've been providing sort of that one-on-one support for those agencies. We also created a Google email address for our leadership team, and that includes MSR review component. So we encourage all SOAR providers to email us their first couple of active MSRs so we can provide support, but also just that people can send us any questions they have about SOAR, anything that's going on. We use that to organize our documents. We share a Google Drive, so whenever anyone becomes a provider, we give them access to that drive, which includes our record requests, all the releases, all the DC-specific documents, everything they might need. We have a listserv for SOAR providers and SOAR leaders. That just helps us on our technology and to quickly get information out. We encourage everyone to use OAT. We just this year have started doing SOAR site visits, so each agency that's doing SOAR, I've been out and meeting with them and learning about sort of what their workflow looks like and what they might need to help them have a successful SOAR program. One thing that we've learned is that depending on the setting, certain methods might work better for them, or like how do they do screening, that they have the right technology in place and things like that. And that's been extremely helpful to kind of troubleshoot specific issues at agencies. Definitely have a lot of challenges. One downside from the leadership moving out of DC government is that DC government does not necessarily know us. And so, for example, just in the last couple of weeks, it was actually the same day, the same week that we heard that we were in the top 10. We heard that someone at a CH meeting, one of the leaders had reported that she heard that SOAR is not working. I think that also comes from a lack of understanding about what SOAR is. People say that word, but maybe don't understand that it's actually there's a specific model that we follow. Maybe people think that it's just applying for Social Security benefits. Lack of knowledge about training. So we've also heard of sort of some rogue training happening that's not consistent with us. And so we are getting out there. We're attending more meetings. The advocates are really, since they know the right players, they're getting us into these spaces so we can share our successes and also start to make some recommendations about where we think SOAR might be the most useful. We have another challenge is that DC government agencies seem to work in silos. So Behavioral Health and Department of Human Services all have talked about SOAR, not together. And so, again, just working with advocates to come up with a SOAR strategic plan to present to these agencies. And also, IDH just asked us for a report on how SOAR was going. And so we were able to have success with, and also where we think changes need to be made. And specifically, we're hoping to get SOAR defined better in contracts, so what we mean when we say that, and specifically that training is happening the way that we're suggesting, and also that SOAR providers are engaged with our provider community and not just out there doing SOAR by themselves. DC government is one of the places that has IDA, or interim disability assistance, which is great, but unfortunately people think that SOAR should be able to fix. The IDA has a very long wait list right now. And so they're conflating IDA with SOAR, and so that's another trouble, is thinking that somehow SOAR is not working because IDA isn't being paid. So that's another conversation we're having about how we can maybe play a role, but the challenge is that people who are getting IDA have already applied for benefits. So figuring out how to put SOAR and what the best intervention would be is something that we're working on. So continued funding struggles where we have those grants, they're time limited, and we're worried about what's going to happen if they run out. And then also a lot of the places doing SOAR, for example, here at Bread for the City, I'm paid, we're not paid for the work that I do either for SOAR or for the support we're giving DC government. So we're just all looking at where we can make sure that the SOAR funding stays in place. And so we are working with advocates to suggest how DC government can make sure that the programs that are successful, like Abby, are continued, the funding continues even if the grant runs out. Oh.
Thank you so much, Ashley. So we can't wait to hear about what the rest of you have been accomplishing this year, and I know that you are transforming lives one application at a time. Super SOAR says that you are a SOAR superstar. So we have lots of time now to open the floor for questions or comments, and there are two ways that you can ask our panelists a question. And either do that by typing your question into the Q&A panel that's located underneath the participant tab here, or to ask a question by phone, you can raise your hand by clicking the hand icon in the participant pod, and we can unmute you to ask your question. We had a question come in from Timothy, and he asks, do we encourage a state that doesn't have a state team lead? So the best step is to talk with your SOAR TA Center liaison about kind of strategies for identifying a good organization or kind of play in the state who could take on that effort. So we do have a number of states right now that don't have a designated state team lead, and so the best strategy is to think about an organization that could take on some coordination, that has some sort of statewide presence, a kind of passion to do SOAR and see SOAR in the state and go from there. The question about working on an application. So someone has a client who says he was denied 3 times for Social Security, and she wants to check on the application and how to do that. So the best thing to do is to work the individual to sign an SSA 3288, which is the authorization to disclose information, and you can submit that to your local SSA field office. Let you know about any prior applications and if there is a pending application, so if there's a current application pending. If not, then you can work with the individual to develop and file their application, and it's a point that you would use the SSA 1696 to become the representative and all of that. But if you're trying to figure out status, you can use that 3288 authorization form to get info. Great question. Question come in for OAT, and I actually want to open this up to our panelists to see if they have anything to add. So Donovan is wondering about some strategies for maintaining OAT use with other agencies. I'm wondering, Ashley, if you had any comments on that about how to encourage other agencies to report using OAT.
Sure. This is not reporting our last year's outcomes, but just this year we've started talking about it at every meeting that we have. And then also doing, like I said, these site visits where I do some targeted outreach. I talk about OAT there and just confirm that everyone has asked me to know how to use it. And then also just been checking in a little more often to see if people are reporting, and that way we don't have to just them in August, but we can try now. So it's still a work in progress, but that's sort of the plan, is to just monitor a little bit more throughout the year, and again, just to do some outreach agency that we don't have SOAR providers.
Fantastic. And I'll open it up to Linda or Abby if either of you wanted to have any additional comments about encouraging OAT use.
This is Abby. So I know that one of the things that Christy does in Arkansas is outcome reporting is mandatory for all SOAR trained case managers within the Mid-South health systems. And so what she'll do, like Ashley mentioned, is just really talk about the importance of it. But one other thing she does is she is alerted whenever a SOAR application is started within her agency so that she's able to follow up and track. And while that may not be we may not be able to do that in larger areas, that certainly has worked within her system, especially since she's kind of overseeing it as a SOAR local. And in speaking from New York, I know that, like Ashley, the more you can talk about the importance of tracking outcomes and how those outcomes can benefit your local community, the more you can show the SOAR applications are being done, they're getting approved, the more likely this is to garner more funding for your community. That has really been a big sell for us as well.
Right, we have someone who raised their hand for an audio question. So, Nicole Pace, are you there? Do you have a question?
Yes, I want to know, I'm currently taking the online course. So I would like to have someone, like a mentor, that would help me walk through this process, because sometimes when you have to back and forth reading and it takes a lot of time, and I know that they are suggesting that you take within 10 days, and there's a lot of reading involved in trying to remember these terminologies and really, making sure you have a good score and make sure that you complete everything right. I think it would be beneficial if there was somebody that maybe you can look with when you're actually going through the process, or when you have these questions, or if it's something that you don't understand, you have to go back through the whole pillar all the way back over to get a good understanding. Have you ever thought about that, or maybe is there someone in Arizona that I can link up with to make sure that I can do a good job when it comes down to actually putting in these applications?
Nicole, it's such a great question, and absolutely we can link you up with someone who can help answer your questions as you work your way through the course. So the SOAR TA Center liaison to Arizona is Pam Hine, and she would be more than happy to help provide that support for you. So you and kind of everyone else on the line in general, the best practice that we encourage for completing the SOAR online course is to do so in a cohort model. And that's only available when we have a local or a state lead who can help to organize folks, bring them together to do the course together in kind of a coordinated fashion, and having kind of check-in calls with that local lead who can help answer questions. And so that is being done in some localities, and unfortunately we don't have a local lead in all parts of the country to help do that. But at any point, if there is someone like yourself, Nicole, who's working their way through the course instantly, here at the SOAR TA Center, we are more than happy and willing to help provide that support one-on-one for you. So we will get you connected up with Pam Hine. You can email her directly at Heine@PIAINC.com, and we'll put her email address in the chat space too. We'll get connected to get that support there. Thanks, Nicole. I have another question that came in from Rebecca. She says there's a huge need for more SOAR providers in her county, as she's the only one who's working for, and she's going to be going on maternity leave in a couple weeks. Congratulations. She wants to know how she can encourage other nonprofits to possibly add a SOAR position. Funding really seems to be a huge issue. So, a good thing to do right now in the meantime is to get in touch with your SOAR TA Center liaison, let them know, specifically about your issue, and we can see what can be done in the meantime, or I should say, about making sure that there's, some sort of coverage. And then in general, SOAR leaders to work on a funding and sustainability plan to engage more providers, bring more people into the process, kind of share the word about SOAR, and also kind of work together to pursue funding opportunities. So we have a funding opportunities page section on our website where we post new opportunities that we come up with and kind of ideas for taking down ways to kind of either fund SOAR positions with new funding or to reallocate existing funding, and to really show providers why it's in their best interest to begin implementing SOAR. So I also want to open it up to Ash to add any kind of thoughts she has about that, because I know that's something you guys have been working on a lot in DC.
Sure. Board of Trustees has had a history of doing Social Security applications, so that was an easy thing for us to just expand our program in that way. And then there was another nonprofit who was basically doing the same thing. I found that it took just one person who was really interested in that, and she really helped her agency expand. Now they're doing it a lot too. And then we are having a hard time convincing other nonprofits to do it on top of everything else they're already doing, which I totally understand. So one thing that we've been working at is thinking through in DC government who gets money from DC government and where it makes sense to write it in part of the contract so it's actually a part of someone's job. And so that's what we're working on now. For example, we think it really makes sense for it to live, every person in PH or public supportive housing to have access to a SOAR provider. So that's one of our goals, is to get SOAR specialists at PSH agencies. And so I think that's sort of our next step is working on looking through what are the places that make sense and making sure that it's written into contracts so that that have more of an incentive to do it, basically. And obviously talk about the benefit to clients, the benefit to some, even for PSH, that would be income that individuals would have to be able to pay a portion of their rent, and just looking at it from that perspective as well.
Absolutely, thanks. We definitely see that when, SOAR can be incorporated directly into contracts and there's that requirement to do the work, that we see more kind of implementation, more tracking, actual benefit. It's a much stronger than just somebody trained and hope that they can fit it into the work that they're already doing. Thanks, Ashley. All right, I have another question that came in from Mark, and he wants to know how SOAR connects with prisoners or those that are in the criminal justice system who might qualify for this service. And so it works in different communities and different settings, Mark. And so when there is a provider trained who is a community provider and they want to work with their local jail, maybe their county jail, make a connection there. So I can give you an example of a jail in Atlanta, Georgia. We had a connection with the public defender's office. And so the public defender's office had social workers on staff. They would help us identify people who had a serious mental illness, who were unable to work and may be eligible for SSI and needed our assistance. And they would make kind of a referral to us, and we could go and assist with an application before someone was released. Other times there's, a Department of Correction that has that are trained, and so they're, counselors or other staff directly in the facility that are working with individuals and maybe working on the mental health unit, or someone is identified as being close to release. So, a release date within 30, 90, 120 days, depending on previous agreements that are eligible for SSI, and different facilities have different ways to identify people for benefits, and they work with folks that way. So we have a expert on SOAR with criminal justice agencies, Dazra Ware, and we'll put her email address up in the box and send that to you so you can talk with her more directly about specific situations. So if you're thinking about a facility near you that you'd like to engage with, and the best way to kind of communicate with them or to identify some need assistance, that would be great. Another question come in from Amy, and she says that they struggle with constant communication with DDS, and they have kind of varies of understanding of what SOAR is within that department. And so she's wondering for states that have a designated DDS SOAR examiner supervisor where you started that relationship with DDS. Did you want to kind of speak to how you guys got your collaboration started?
Sure. So we, I think the position is something like, I can't remember the title of it, but it's something, it's like the community relations officer person. They do outreach to the hospitals and again, people signed up for ERE, for the Electronic Record Express, things like that. That position, there was someone who had been doing that job for a very long time who went out to the community and got to know the different players, and so that was sort of where our first connection was, and we had that connection with him for a very long time. But then he moved on, but thankfully before he left his job, I was able to connect with a couple other people there. He actually brought me in. I requested a meeting, and he brought me in and let me talk to some of the staff there. So I just slowly built some connections with examiners, and then ultimately the person who replaced him, she already knew because we already just kind of made our presence known. She knew about us, and so she kind of continued on that relationship. However, it wasn't until she was a little bit of like supportive of this, but we can't do anything different. And so I realized when she left, I realized that actually what she was doing was kind of standing in our way a little bit of what we really wanted, which was a dedicated group of examiners. And when she left, I contacted her supervisor, and he was very, very quickly understood because, again, he'd already heard from her about what work we were doing. He saw the importance of what work we're doing he was very quick to just create this system. So it happened basically overnight with not a lot of effort at that point by the time we had access directly to him. But it was a long, it was a lot of like laying the groundwork over the years to be able to get there. Now he gave us one supervisor, and then she has been our main SOAR contact. We also developed a really great relationship with their IT guy, who, again, like I would never have expected, but he just happens to always answer our phone calls and can do basically everything. And so it seems like it's just a matter of like finding the one right person as a start. But that position, that community relations person, might be a start, because that's kind of their job, is to do outreach to the providers.
Thanks, Leigh. That's awesome. And in some communities at DDS, that person is called a professional relations officer or a pro. You might see that acronym out there. And Amy, the other piece of advice I can offer is that if you have us connect your contact with a person in another state who is a champion and advocate for SOAR, we can do that. We have some really great DDS advocates who are more than happy to speak with other state DDS about why they support SOAR so well, and collaborations have been good for them at those DDS offices. So, do a peer-to-peer communication if there's any kind of hesitation about the collaboration. Okay, we have another question in the queue specifically about the crisis application or prison filed applications, and Annie wants to know if those approvals and denials are being tracked. So yes, maybe as much as we would always like more outcome tracking in providers across the country, but we get lots of wonderful outcomes reports. You've seen the webinar. So we can, there are some criminal justice serving agencies that have reported their outcomes, and we can give you, more details about that. But, SOAR provider, each facility, they, decide when, if they track outcomes and report them. And so some of them use OAT, some track their outcomes in a, internal system and report those to us. Spreadsheet or just via email. It looks different in different providers. Other questions out there? Gary, staff, any other questions?
No, I just do want to add that even though Christy and Shadun were not able to be here today, they wanted me to tell you that they are more than happy to answer any questions or any peer-to-peer connections that you guys, or if you would like to talk with them about how they've been able to establish such a successful SOAR initiative, they would be more than happy to talk about it.
I'll just add one thing about SSA and DDS collaborations in general. I saw another question, Lila, about kind of strengthening the DDS relationship beyond that initial connection. And we have a really great tool on the SOAR website, which is a kind of conversation guide with SSA and DDS. And it kind of walks you through different priorities that you might be wanting to discuss with SSA or DS, a different type of collaboration. Maybe it's that you want to talk about having a dedicated examiner on a DDS unit. And so what our conversation guide does is it kind of outlines what benefit to DDS. What's the benefit to SOAR? Why would this be good for DDS to do this? Why does SOAR want it? And kind of how to have that conversation, talk with them about. So I'd really encourage you to check out that tool on our website, and we can put the link chat box to that as well. You get that. questions? Please say aye. Any comments from our panelists? I want to thank you all of you that are SOAR providers on the webinar for all of the hard work that you've done. And thank you again to our presenters for sharing not only your experience, but also reminding us why it is we do the work that we do. And take care. Thanks, everyone.